It's been a dispiriting day in the fight against COVID-19 with record case numbers in New South Wales and the outbreaks in Victoria and the ACT continuing to grow. But there has been some good news with that 4 million dose vaccine swap deal with Britain. To take a closer look at the situation, I'm joined by AMA President Omar Khorshid. Welcome to the program. What do you make of the situation that's unfolding today?
Afternoon, Dan. Well, we've certainly had some good news on top of the bad news that you mentioned, and the bringing forward of around 4 million doses of the Pfizer vaccine is going to have a huge impact on our rollout of that vaccine into the community, and will actually allow the rest of the general practitioners who've not yet been able to deliver any Pfizer to their patients to be able to start participating, and we can get even further ahead of where we thought we'd be at this point in terms of the vaccine rollout. So that's some great news, but it comes on top of some more worrying numbers around the country. And of course, a difficult discussion going on between our political leaders about what opening up next year is going to look like.
Well, it strikes me, Dr. Khorshid, that there's been really mixed messaging here from the states, different states and territories of the Commonwealth about what exactly is the strategy. What do you see it as?
Well, I think the state premiers are all very aware that their job is to protect their people and to keep them healthy. And in states that don't have COVID, they're very worried about the thought of opening up. And in some states, a good example is Western Australia. Part of the reasoning behind that is the fact that the health system just isn't ready to deal with any extra load. It's not actually coping with the current loads without any COVID and without any flu. So there's a lot of work to be done to prepare those states. And perhaps it may mean that opening up at 70 or 80%, according to the Doherty modelling, maybe that won't work if the health system isn't actually able to cope with that extra load.
On the point that you might have heard from the Queensland Premier Anastasia Palaszczuk a moment, saying that she's concerned that there's not enough data, particularly around those under 12, does she make a point there around the data that's been compiled thus far?
Well, the reality is we don't actually have a vaccine that's approved anywhere in the world for the under 12s. And we also know that children are much less susceptible to severe COVID infections. So, of course, we need to keep our children's safety very much at the centre of our decision making as we go forward. And it's really not that helpful to be locking governments into positions right now when we don't actually have a vaccine for children. But certainly towards the end of the year, once we've got some data from the US, from the big trials being done, once we know whether there's a licensed vaccine, we are going to have to make that call of whether to protect children through public health measures and HEPA filters in their classrooms, through mixed learning, including some remote learning, using those sorts of measures, or are we actually going to vaccinate them all before we actually open up and expose them to COVID? But those are decisions for the future.
On the Doherty report and the national plan, do you see there being inbuilt flexibility there for different approaches for different parts of the country?
Well, what's in the Doherty report is a lot of assumptions. And of course, those assumptions are based on an estimate and on guesswork. And of course, the reality can turn out to be different. Now, one of the key assumptions is that we've got effective testing, tracing, isolation and quarantine. But we're already seeing in New South Wales that there's a real limit to how much of that can be done. And it's unlikely that any state could cope with tens of thousands of cases and actually keeping on top of that. So that means you fall back to the Doherty's other modelling, which is the more worst case scenario, where the numbers are a bit scary, where people are dying and where the hospital system would clearly be struggling to cope with that kind of demand. So we need to take a realistic look at those Doherty numbers and also feed in our hospital capacity, our overall health system capacity, before making decisions on when to open up those states that don't have COVID at the moment, and of course when to start relaxing the lockdowns for those states living with COVID.
Omar Khorshid, we're seeing more and more concerning information coming out of Indigenous communities, particularly in parts of New South Wales, although there's been some discussion about Shepparton as well. But these bigger outbreaks, particularly in Wilcannia and Dubbo, what is your read on the situation there?
Well, we've identified right from the very start that the key groups that needed to be vaccinated were those at the highest risk of either contracting COVID or getting extremely sick with it. And unfortunately, despite recognising this, our Indigenous communities, particularly in those remote areas, have been let down by our collective effort to get them vaccinated. Now, I recognise that some of that is due to hesitancy. There's been a lot of misinformation on social media that has driven some of that hesitancy. But at the end of the day, it is our job as a community, and it is the job of our state and federal governments to make sure that the most vulnerable people in the population are protected. And we've got to do better when it comes to that Indigenous vaccination rate. I'm really hoping that this focus now on that failure so far will actually drive further action from federal government, state governments, and of course, the healthcare services close to those communities.
And there have been a litany of Indigenous leaders calling for there to be greater communication strategies in language at the community level to deal with those very questions you raised. Just finally, we know that there are many, many Australians that are in lockdown now, 13 to 14 million in fact. What do you say to those that are starting to feel weathered and worn down by these lockdowns?
The lockdowns are tiring everybody out, and I think even talking about the lockdowns for those of us not in lockdown feels awful. So it's hard to imagine just what many Australians are living through, particularly in Melbourne and in Sydney. Now, the message I think for everybody is that the lockdowns right now are what is keeping the community safe. The vaccination levels are not high enough yet to have any thought of opening up. And these lockdowns have saved thousands of lives so far and will continue to do so until we get that vaccination rate high. So the way out of lockdown is to get vaccinated. And the simple message, I think, to all those living with lockdowns is if you haven't been vaccinated, go and get vaccinated today with whichever vaccine you can get your hands on, because that's the way to get out of lockdown.
AMA President Omar Khorshid, thanks for